Research by Dr. Gene Cohen at George Washington University and others shows that elders who vitally engage in professionally led arts programs like the Dancing Heart live longer, go to doctors less, take less medications, fall less, and have better overall health.
This is part of the power of the Christmas Carol with Ebenezer Scrooge. When the ghosts came in and applied creative dream work and imaging techniques, these were art techniques that helped Scrooge free up these emotions, deal with this chronic depression that had been missed.
And Einstein College researchers found that dancing is literally at the top of the list of leisure activities that appear to play a part in delaying the onset of Alzheimer's disease.
Dance has so much going for it. Howard Gardner in the field of education has talked about multiple intelligences, that some are visual learners, some are verbal learners, some are kinesthetic learners. In dance, I mean, you have all of those elements.
During a 3-year collaboration with the Wilder Foundation Adult Day Memory Care Program and forward-thinking funders, evaluation showed the Dancing Heart helped 43% of participants improve functional strength, endurance, and balance. Anecdotally, we observed increased sociability and participation, and sustained cognitive functioning. And the Wilder program may never be the same.
When he was first diagnosed, his neurologist told me that he would probably have 10 years to live. And I was just bleak. It was bleak. It's almost 10 years and he is still walking, talking, eating by himself. He's stimulated here. He's encouraged to do things. At home, if he was sitting at home, he'd be in front of the TV and he'd be in a nursing home today. I swear by it. He is worth it. He's worth keeping around for a while longer, and I think Dancing Hearts helps that.
What I have seen is that people have maintained at a higher level based on whatever level they were when they came into the program, and they haven't declined as fast as I really think without this kind of stimulation and so forth, they would have. And when we're talking a 3-year maintenance, we've been able to keep people not declining, and that's huge. What we do see is that following the group, people's verbalization and their socialization increases. There's more ease in the setting. It carries over into what the next thing that they're doing, and for some it carries over for the full day. You know what? The sky's the limit. We don't know what people are capable of, but we need to encourage that. We need to provide an environment that allows for creativity.
In a 2-year collaboration with the Ebenezer Foundation, supported by Medicaid funds through the state of Minnesota, the Dancing Heart is seeking innovative ways to improve long-term care and reduce costs. Along with curriculum development and staff training, we are creating a best practice model for further sustainment, replication, and diffusion.
She commands respect.
She does. She does. Someone had said this, we were talking about the projection, what you imagine older people, older adults to be. Because obviously they can be very collaborative, they can be very creative, they can be imaginative and artistic. But I want to say that our culture does not usually think of older adults being all those things.
There's a cultural synergy that happens, and the unexpected and very fresh and very creative things happen that go beyond anything we could plan.
At mid-project, the preliminary results are affirming. Using sit-stand and mini-mental assessments, we see marked improvements in balance and muscle tone and improved memory. Plus, anecdotally, we observe significantly improved self-confidence, enthusiasm, and staff satisfaction.
I think that we lose the real benefit if we're just looking at this as a means of entertainment or something that just kills some time, because it's a much bigger piece than that. You observe how that spark has been relit, and to see that happen in a somebody that you care about is very moving.
It's taken some time, like 12 weeks, to be able to just try to see really what it is we are doing. But then when we started, probably about a month ago, really seeing different significant changes with people outside of the room, and it was from feedback from nurses, it was feedback from other staff. Those are the kinds of things that are measurable.
I love to dance.
We were honored to receive the 2007 Award for Excellence in Program Innovation from the Archstone Foundation and the Gerontological Health Section of the American Public Health Association, and one of the 2008 Mind Alert Awards from the American Society on Aging, in collaboration with MetLife Foundation. The Dancing Heart is included as a best practice program both in the National Guild of Community Schools of the Arts, Creativity Matters, the Arts and Aging Toolkit, and in the National Endowment for the Arts, Office of Accessibility, Arts and Aging Resource List.
You're never too old to dance. At least that's what Maria Genet believes.
We appreciate the press attention. Our vision is to continue to work with forward-thinking community artists, healthcare professionals, funders, volunteers, and individuals and their families to effect sustainable culture change and support lifelong learning. Because the best way to save money also might be the best way to live. Dancing.
Our programs, our arts programs, have been a centerpiece for bringing in new families and clients to be able to see the rich life that can be lived at a long-term care facility.
If you have people who are visiting the place and they see people with a smile on their face who are dancing, who are singing, who are drumming, who are drawing, this is very, very powerful. This is home at an elevated level.
Good story.